Hello, my name is Thu. I'm a Pharmacist Candidate, class of 2021. In this video today, I will be talking about the medications named Quinapril, which has the brand name of Acropril. I will be going over some key points for the drugs including patients' counselings, mechanism of actions, formulations with dosings, adverse events, drug interactions, warning, and some monitoring parameters.
We should consult patients about the use of this medication. Quinapril is used to treat high blood pressure and heart failure. It also usually dosing once a day and take this drug by mouth with or without food. Patients should take this medication at the same time of the day. Drink lots of non-caffeine liquids unless told to drink less liquid by the doctor. Take a missed dose as soon as you remember and do not double up the dose within a day. This medication should not be taken when the patient is pregnant or become pregnant. Some of the common side effects of people taking Quinapril including dizziness and dry hacking cough. Patients should report to the doctor immediately if they experience any of the symptoms below, including cough that causes troublesome or does not go away, any allergic reactions such as rash or hive after taking these drugs, any signs of high potassium level like irregular heartbeat, feeling weak, numbness, or tingling, or any signs of kidney problems such as unable to pass urine or blood in urine. Quinapril belongs to the class of angiotensin converting enzyme, as known as ACE inhibitor. This medication is indicated for treating and manage hypertension, people with heart failures. It also has use for off-label for non-ST acute coronary syndromes and ST myocardial infarction.
Quinapril inhibits angiotensin converting enzyme, an enzyme which catalyzes the formation of angiotensin II from its precursor angiotensin I. Angiotensin II is a powerful vasoconstrictor and increases blood pressure through a variety of mechanisms. Due to reduced angiotensin production, plasma concentration of aldosterone are also reduced, resulting in increased excretion of sodium in the urine and increased concentration of potassium in the blood. Quinapril also prevents the breakdown of bradykinin, which stimulates the vasodilations that cause enhancing the decreased blood pressure effects, but also associated with angioedema and cough side effects of this medication. Quinapril comes as a tablet oral form. The available strengths range from 5 mg to 40 mg. To treat and manage hypertension, patients can be given Quinapril with initial dose of 10 to 20 mg once a day, and it can be titrated up to the maximum dose of 80 mg per day in 1 to 2 divided doses. If patients have creatinine clearance greater than 60 ml per minute, their initial dose can be 10 mg once a day. If their creatinine clearance from 30 to 60 ml per minute, initial dose is 5 mg once a day. And if it's that between 10 to 30 ml per minute, initial dose for Quinapril and hypertension patient is 2.5 mg once a day. For any patient who has creatinine clearance less than 10, there is no specific adjustment provided in the label. For patients with heart failures, initial dose can be 5 mg twice a day for Quinapril, and the target dose to 20 mg twice a day. If patient has creatinine clearance greater than 30, initial dose is 5 mg once a day. If their creatinine clearance is from 10 to 30 mg, initial dose is 2.5 mg once a day. And again, if any patient has creatinine clearance less than 10, there is no specific adjustment provided in the label. In addition, there is no dosing adjustment is required for a patient with hepatic impairment. Quinapril is a well-tolerated medication in general, but there are a few things that we need to watch out for. Some adverse events of Quinapril including hypertension, non-productive cough, hyperkalemia, and dizziness. Patients should avoid co-administering anastrozole with any type of ACE inhibitor due to the risk of angioedema and hypotension. As a result, 36 hours washout period is required when switching to or from Quinapril. Patient is taking Quinapril with lithium concomitantly should be monitored for lithium toxicity. Patients should also be monitored for the kidney function if they're taking Quinapril with other nephrotoxicity agents such as NSAID, direct renin inhibitor, loop diuretic, or thiazide diuretic. Some of the contraindications include angioedema related to previous treatment with an ACE inhibitor in the past, concomitant use with aliskiren in patients with diabetes, concomitant use with neprilysin inhibitor such as sacubitril, which is one of the components of anastrozole, or within 36 hours of switching to or from neprilysin inhibitor. Some precautions are Black patients, pregnancy, patient with aortic stenosis, renal impairment, or patients with cardiovascular disease. Some monitoring parameters are blood pressure, blood urine nitrogens, serum creatinine, potassium level. In patients with renal impairment, they should also be monitored for CBC with differentials periodically.